COAF just published the first ever academic paper on how patients in rural Armenia perceive the quality of care they receive. This is the first time their voices are being captured in this way, and some of these findings may surprise you. So what did they have to say? That's today's topic. Number 1, how people are treated matters. Across so many villages, people said one of the most important aspects of care was վերաբերմունք, how healthcare professionals treated them. Another thing that came up a lot was munat, an unempathetic or rude, dismissive, and sometimes even condescending behavior on the part of healthcare providers, which discourages patients from returning to their clinics. Many residents told us that sometimes just a good conversation made them feel better. Number 2, patients often have low trust in the system. There was evidence that people are not satisfied with the care they receive, and in fact, sometimes they just don't trust it. And partly because trust is low, people sometimes bypass primary care and go straight to specialists, even when they shouldn't have to. That type of defragmented care can cause real harm. Number 3, patients often perceived lots of testing to be a sign of good care. Some patients felt that if medical professionals didn't provide a long list of lab work or other testing, even if it was unnecessary, then they weren't providing good care. Interestingly enough, at the same time, patients were ignoring some other important tests. One woman told us she had spent a fair amount of money on testing for some stomach symptoms, testing which it turned out was likely unnecessary, but that she had completely ignored the invitation for a free mammogram. Andesele is what she said. We saw this time and time again. This type of contradiction is important to highlight because if we want to help improve healthcare outcomes, we need to understand why people are making these decisions. People want to understand their health issues and ask more questions. Many people said that they wanted more future discussions like this regarding their healthcare issues, highlighting both the value of connecting directly with community members and the opportunity those conversations can provide to improve communication between residents and the healthcare system. This study tells us more than just how patients perceive their healthcare. It helps us to understand where we need to improve and partly how to get there. We need to work systematically and continuously, hand in hand with our communities and healthcare workers, to help build a healthcare system that results in better healthcare outcomes. We need to see our residents and our patients and our communities not only as beneficiaries, but as the key fundamental stakeholders in the process.